My name's Christy White. I'm a physical therapist here at Fraser Medical Center East, so my clinic's right over here. I've been a physical therapist for about 10 years. I have a specialty in neurology. I've been working with people with Parkinson's since the beginning, so kind of grown a little bit of passion for this patient population. Enjoy working with these people, but I also treat people with all different neurological balance conditions. So started working with the National Parkinson's Institute over the last year or two, kind of collaborating as needed, and then see some familiar faces here. So the original kind of intention was just kind of neurological health for today's talk, but we kind of honed in on an area that Eric and Erica felt was kind of prevalent concerns within the National Parkinson's Institute community, and that was falls. So we were going to spend a portion of it kind of talking about falls prevention, specifically to Parkinson's, and how to manage that. And then we'll kind of go into a little bit more broader topic if anybody has any specific questions about general neurological health. I'll touch on a piece of that towards the end of the talk before we open it up to questions. But this is obviously a big concern with anybody with Parkinson's, especially as the disease progresses. So falls incidence and occurrence. In the U.S., 1 in 4 adults over 65 report a fall each year. About 37% of those require medical treatment. It's one of the most common reasons that anybody over the age of 65 goes to the ER. So, and one of the leading causes of bone fractures and brain injury for people over 65 as well. Not to scare you, but just to make you mindful that it is, that's why people are so concerned with falls, is because it can really put an impact on your health, but also kind of the medical system as a whole. Leading cause of fatal and non-fatal injuries among older adults. So 68% of those with Parkinson's experience a fall compared to only 27% of all older adults. So as you would assume, a higher percentage of people with Parkinson's. So, falls predictors for Parkinson's are if you've had a previous fall, the disease duration, so those that have had the disease longer at a higher risk, reduced arm swing. Arm swing is a big part of your kind of balance control. So as you're walking, as you walk, your arm should be moving in the opposite direction of your other leg, and that's kind of the normal walk. With Parkinson's, that becomes smaller and even absent. It usually starts on the affected side, and then will often move to both. And so as you're walking, if you have reduced arm swing, it's not just the reduced arm swing that's going to make you an increased risk for fall. It just shows that the disease has now progressed bilaterally, so it's affecting both sides. And you're getting less trunk movement and less responsive movement from your trunk and arms. So it's not purely the arm swing, but that's just an indication, like a visual thing that we can say, okay, if this person isn't swinging their arms naturally when they walk, then the disease has probably progressed, it's probably on both sides, and they probably don't have much of their balance reactions. Dementia, obviously anytime cognition's impaired, that increases your risk for falls. I want to put loss of arm swing on their book. Or twice. So a lot of this stuff a lot of you'll have probably heard, but it's nice to kind of get a visual and kind of point some things out. So there are things within your home and within the community that are going to increase your risk for falls. One big thing is throw rugs, and especially ones that are kind of fluffy and they're not really grounded onto the floor. So we try to eliminate throw rugs in the house as much as you can. I know it's a couple places that it's important to have them. So we always encourage ones that have non-slid backing and then thin rugs. But really trying to minimize any throw rugs in the house, especially in areas that you're doing a lot of walking. And then loose carpet. So I mean, I think that just means that if the carpet, like older carpet that kind of gets bunched up or has like ripples or whatnot, that's another tripping hazard. Stairs, especially if they're really steep or they're like older stairs or they go into the basement that don't have a lot of depth, And then if they're old or the handrail's not stable on it, the stairs are also a big falls risk at home. Loose grab bars and handrails, a lot of times people, if they do lose their balance, they rely heavily on those, and if they're not mounted properly or they're old and they haven't been assessed lately, they'll come right off the wall with you. So, clutter on the floor. I have 2 young kids, so this is like when my grandfathers come over, I'm like, I just like take a broom and just push it all off to the side. So clutter is a big issue, but that could just be furniture, cords, decoration. So trying to minimize that, especially with Parkinson's, you really want your walking space to be wide and open. Okay, so it's okay for you to have like decorations up on the mantle and up on shelves, but on the floor, you really want to try to minimize that, especially if you're using an assistive device. Obviously, you need wide spaces. So kind of minimizing, decluttering your house, getting rid of stuff up off the floor, making all of your walkways as open as possible. Reduce lighting. So vision plays a big role in your balance, and we'll talk about that a little bit later. So when it's darker, whether it's early morning or just you don't have great lighting in your house, you're not getting as much visual input. So your body's not getting that piece of the balance system that it needs. So really encouraging making sure you have good lighting, especially in the areas that are more of a high risk for falls. Bathrooms, hallways, stairs, all of those are super important. So getting up in the middle of the night, as many people would probably assume, is more likely to have a fall. So make sure you have some lighting, either easily accessible where you can just push a button next to your bed, or you have night lights kind of set up in the areas that you need to travel. Curbs and parking stops. Curbs are always difficult, especially, first of all, just managing them, but then, but if you don't see them. Parking stops are just like the concrete things in front of the parking. We have people trip and fall over those all the time. And it is, it's just because a lot of times it just sticks out just enough. You don't see it, or you're kind of managing it, something else around the car. So those are a big one. So just be mindful in the parking lot. And sometimes parking lots have them and sometimes they don't. So I think it's just being mindful of your surroundings, because you don't want to step over them. It's better to just go around them. Uneven ground, of course, gravel, rock, grass, sand, anything uneven, or even just an older sidewalk with the kind of root growing through where it may make the sidewalk a little uneven. Rain, ice, and snow, we know about that. So obviously all of those are going to increase your risk for falls. So if you need to be out, make sure you're kind of prepared for that and have an extra person with you, and kind of preparing, kind of making sure you have the right footwear and the proper assisted devices, but also just avoiding that when you can. Polypharmacy. So what that means is you have to take a lot of medicines. So one of the number 1 side effects of all medication is dizziness. And when you take multiple medicines, they often interact and increase your risk for having symptoms of dizziness or lightheadedness or imbalance, and increasing your risk for falls. So as we know, as people age, not everybody's taking a lot of medicine, but a lot of people do. And the more medicine you take, the more likelihood that you're going to have that side effect of dizziness, which will increase your risk for falls. So specifically with Parkinson's, so this is where I, as a physical therapist, I spend a ton of time educating people on these, and trying to figure out what it is for each person that brings it on. Not everybody has the same difficulties. Not everybody has the same impairments. So that's kind of what we do in therapy, is kind of help you problem solve. Some people are really good at knowing, you know, these are the things that cause me to fall, lose my balance, and other people aren't as aware of that. But freezing, anybody that has a symptom of freezing is going to definitely be at a higher risk for falls. Freezing often comes on with initiation of movement, so like just getting something started or when they need to stop. Okay, so a lot of times it's either initiation or stopping a movement. And freezing is just your body just kind of gets in this repetitive movement and everything gets really small and not well controlled. Turning. That is for most people with Parkinson's, this is an issue, turning. So we kind of teach people to take really big turns. We talk about wide turns or U-turns rather than just a pivot. So a lot of people that you see walking with Parkinson's, when they go to turn, it looks like this. okay? And sometimes people, it doesn't affect them that much. Their steps get short and they kind of get shuffled, but then they can get right back into their stride. What I encourage is that from the beginning, when you start noticing turns are getting a little bit shuffly or a little slower, to start practicing those wide turns and kind of making that your new standard. Because as the disease progresses, you've already developed this new habit of, instead of doing like a quick pivot turn, I'm gonna make like a U-turn. And you're gonna keep your feet nice and wide. Okay, I often will kind of reference that as like a penguin walk. So when you do a turn, you want your feet to stay at about hip width apart rather than really close together. And that's just gonna help your balance and reduce the risk of any shuffling or freezing. Dual tasking. This is a big one, and this one is hard for people to always recognize themselves, and so it takes an outside person to kind of see that. Dual tasking means you're doing two things at once. Walking's one of them, so anything else you're doing on top of walking counts as a dual task. So that could just be a simple conversation. That could be turning a light switch off as you walk out of a room. It could be trying to get your cell phone out of your pocket. Any of that is considered dual tasking. Very simple task. Can be difficult. I have some patients that you're walking with them and all you do is ask them one question, or they stop to tell you something and they start shuffling, or their movement becomes a little bit more difficult. So it could be as simple as having a conversation. And so with that, what we encourage is to try to find out what those things are for you and what you can do safely. If you can dual task, great, that's good practice. We want you to dual task while you're walking. If it makes you unsteady or your movement decline, then we encourage people to stop. So tell your family that if we're going into a doctor's office, don't talk to me until we get to where we need to be. But it may not be for all of you. Some of you might not, you might be able to carry a conversation as you're walking. But again, just kind of knowing those things. As the disease progresses, it will change over time. My grandfather has Parkinson's, and he was having some issues walking in and out of his bedroom. And I kind of assumed it was the doorway and the threshold that was tripping him up, because that's another big thing for people with Parkinson's. But he walked in his bedroom, no problem. And I was like, well, that kind of threw me off, because I was anticipating it to be the doorway. And so he went in, he sat down in his bed and kind of showed me his normal routine. And then when he went to walk out of the room, he turned off the light switch and he started shuffling. And I was like, oh, it was the dual tasking. It wasn't the doorway, it was the dual tasking. But anyways, so jumping down, narrow spaces, threshold, doorways, all of those can often be difficult with people with Parkinson's. A lot of it is this visual perception piece. You see this small space and you think you need to adjust to it. But really you don't, because you've walked through that doorway a million times and you haven't had to get smaller to get through it. But it's part of the brain's visual processing system. And it has a hard time kind of realizing, like, I don't need to change my movement, even though the space is narrow. So we encourage people to practice walking through doorways, narrow hallways, on and off elevators, and you can practice those larger steps through the doorway, elevator, whatnot. Some people like to count as they walk through those. 1, 2, 3, 4 until they get through the doorway. Sometimes I often will, if there's like an actual true threshold where there's like a little rubber thing or a change of surface, I will tell people to use that threshold as a visual target. So as you start approaching it, you want to step on that threshold or over that threshold, and having that visual target kind of tricks your brain, because the brain becomes more focused on getting to that visual target rather than the narrow space itself. That's a couple options. And then another thing that we'll sometimes do with people that have a lot of trouble in doorways is we'll put some colored tape on the floor. You could do one at the change of the space, and then you could do one on either side. So it almost looks like a little ladder, and you could use that colored tape on the floor as like a visual target to step to or step over, and it kind of breaks up that visual piece that people have difficulty with when they're walking in doorways and narrow hallways.
And I do that for people in home if you guys need that. I haven't done it in a while, but that is something that I would come in and do for you guys.
Distractions, so busy environments, this kind of goes into the dual tasking. Again, this may or may not affect some people. Some people that have Parkinson's have trouble with attention. So they may be working on a task or walking, and if there's a lot going on or conversation, they'll get distracted and pay more attention in that conversation or what these people are doing over here. rather than what they're doing. So again, some people it impacts, some people it doesn't, but busier environments, a lot of stimulus, so any type of distraction can be difficult. We've already talked about narrow spaces and threshold. And then this is a big one, hypotension, so low blood pressure. Okay, so a lot of people with Parkinson's, not everybody, by any means at all, have issues with blood pressure. And if that's an issue, you need to make sure you're talking to a neurologist about it, because it is not as easy to treat as somebody else without Parkinson's, because there's truly a neurological autonomic system that's affected by it. It's not just kind of the normal person with low blood pressure. So when you have low blood pressure, you're not getting blood flow where it needs to be, your brain most importantly. And so you will start to feel lightheaded. And if you don't sit down and that blood pressure doesn't get a chance to rise, you'll actually pass out. Or you'll feel so lightheaded that you'll kind of go to the ground. So low blood pressure is a big concern. Most people see this when they go from lying down to sitting to standing, or if they're just kind of standing for a while. Standing is often more of a trigger than like walking, because at least when you're walking, you're getting a lot of blood pumping back up to the heart. But still, some people, as they're walking, it may drop as well, but a lot of times it's that sit to stand and that initial walking, or just standing in one place, like grooming yourself in the morning or making a small meal or something. So just make sure if you're having any of those symptoms, you're talking to your neurologist about that, because it can be a little bit difficult to treat. And then off times. Off times, as some of you all may know, that just means when your medicine is not that effective. The medicine has a short half-life, the Cinemat, so it comes in and it works really well, and then it starts to wear out of your system or wean out of your system, and then when it's starting to come out of your system, all of your symptoms are presenting a little bit more. We call that an off time. Your symptoms are more present, so you're having more of a risk for falls. So just knowing your off times and not doing any challenging things during your off time. So if you need to do some yard work or put Christmas decorations away or whatever it may be, you want to do that kind of in the prime time when your medicine's working well. Okay, so this is a complex picture. We're not gonna like go deep into, but I just wanna, all of this is kind of what plays a role in your balance. So it's a super complex system. So we'll dive into a little bit anymore, but it talks about the systems that are involved, your nervous system, your muscles, your joints and tendons, your inner ear, your vision, and then of course your spinal cord and brain. This actually doesn't really mention the spinal cord a lot, but there's a lot that happens in the spinal cord before it even reaches your brain that helps with balance reaction. And then your cerebellum plays a big role in balance. Super complex. I'm not even an expert in the cerebellum because it is so complicated what happens in there. And then your basal ganglia, which is the part of your brain that's affected by Parkinson's, plays a big role in that as well. So a very complex system to maintain balance. And up until you have a movement disorder, you don't think about it. It all happens pretty naturally. A lot of it's unconscious. But now as you develop a movement disorder, you have to be more mindful and more conscious of your balance strategies and which ones are strong for you and which ones you have to utilize. So we'll dive a little bit deeper into there, but I just think this is a good picture to show you how complex balance is. So the main balance systems in your body are your muscles and joints, your eyes, your vestibular system, which is in your inner ear, and then your central nervous system. So your vision, you're taking everything in, all right, you know if the ground is flat, you know if the ground is uneven. It helps you kind of process things moving past you, whether you're walking on an incline or it's a level surface, whether there's obstacles that you need to navigate. So your vision is taking on all of this information. Okay, I see multiple people in here, almost everybody in here wearing glasses. So as you age, your vision is not as great. Okay, so that's one thing that actually isn't as good as you age despite having Parkinson's. So vision, it plays a big role. Your inner ear is called your vestibular system. There's 3 little semicircular canals that are in your inner ear. It has hair follicles in there and like a thick fluid, okay? So when you move, whether you're turning or you're in a car or whatever it may be, that fluid in your inner ear moves, and then those hair follicles move. That sends a signal to your eyes and your brain of what movement is occurring. Primarily rotational movement, up and down, and this forward and backwards movement. So the inner ear plays a big role, and a lot of people don't know a lot about it. It's about a dime-sized system kind of deep in your inner ear. So that plays a big role. That can weaken with age. It doesn't always weaken with age, but it can. Specifically because we're just not as mobile as we used to be. I always use the example, like when my 6-year-old goes to the park and he gets on one of those things that spins, he gets up and he stumbles for a minute and then he's fine. I've done it and I've been like nauseous for the next 30 minutes. And that's my inner ear system just not being nearly as challenged as his is. And I'm 35. So at 60, 70, you're not even climbing on the floor as much as you used to be, or you're not getting out of a chair as much as you used to be. So that system is weak. So again, most people, unless you're super active, that inner ear system also is weaker with age. But that's something that can be challenged and trained to be stronger. Yeah. Muscles and joints. So your joints and your muscles and your tendons are picking up in your skin and your foot position. It's all picking up sensory information, okay? So if you step on a little pebble on the sidewalk, your ankle rolls a little bit and your system is correcting that ankle roll immediately, or it should be if it's functioning normally. A lot of that, like I mentioned, happens in like your lumbar spinal cord. It's happening before it even reaches the brain. So a tendon is stretched and it's immediately, the muscles are pulling it back to reduce that tension on the tendon. But that's just a small example, but it's constantly taking in feedback. If it's windy, you're getting this sensation throughout your body that you're getting pushed, and so you have to adapt to that. So your muscles and joints and your skin and all that is taking in a ton of information. Your spinal cord and your brain are having to process that and then send information out to control that and control your environment. So again, super complex. Joints, muscles, all that is stuff that we can improve with exercise, physical activity as well. So, all right, we like to talk about balance strategies. If you lose your balance, depending on which direction it is, your ankles are the first thing to kick in, okay? If I lose my balance backwards, the front of my leg muscles, my lower leg muscles are kicking in to pull my body forward. So ankle strategy is the first thing that happens. If that's not enough to recover my loss of balance, I use my hips and trunk to kind of pull myself back to my center of gravity, okay? And then if that fails, I take a step, or I should take a step, right? Then the next thing that we do is grasp, grabbing onto something with your arms. So we talk about that, the ankles, hips, taking a step. But with Parkinson's, that doesn't always happen. And so then we don't have that reaction timing that we used to have. So with Parkinson's, as you lose your balance, your ankle muscles might not kick in as much. Or they might kick in, but it's not at the amplitude that you want it to. Just like when you take a step sometimes, it's not as large of a step as you would like to take. When you're losing your balance, it's probably delayed, and it's not a strong enough signal to recover from the ankles and the hips or the trunk. All right, so you don't have that quick reaction, and you don't have that power that you need to recover a loss of balance as your Parkinson's progresses. You end up with the trunk rigidity. So a lot of times people end up kind of stiff in the trunk. Not everybody, again. Not everybody presents the same. I'm just talking about common things that we see. So if you're rigid in your trunk and you need to lean forward to recover a loss of balance, it's not very effective. So you're losing your hip or your ankle and your hip strategies to some degree. And then taking a step when you're falling, when you have Parkinson's, is for some people impossible. It just doesn't happen. Some people do, depends again on the disease. But when you lose your balance, to be able to take a step is very difficult for some people with Parkinson's. This is something we practice, okay? You practice this with exercise. You can practice this as an activity. We definitely practice this in physical therapy to start making that recovery of a step a little bit more natural, a little bit more efficient, and It needs to be a large step, it needs to be powerful, and it has to be relatively quick to be effective. So those are 3 areas that you, again, can improve with practice, okay? And that practice is exercise, physical activity, and physical therapy if that's what you need. All right, there's 2 types of kind of balance recovery. All right, we have reactive, which is kind of automatic. It's very quick, it's unexpected. You're walking and a little kid runs behind you and knocks you over, or you're walking in a grocery store and somebody walks in front of you. It happens and you have to respond immediately, okay? That's very unconscious, and your body has to respond without you ever having any input that this is coming, okay? So that's reactive. It responds a lot to the sensory system and some external input, like I talked about, anything that your body, all that sensation your body is getting. And then this is when you use the hip ankle steppage strategy, and that all should be kind of unconscious, automatic. All right, anticipatory is when you kind of know what's coming. So this is when that visual system helps you a lot. So you're walking and you see that the sidewalk is uneven, and then you know that you need to kind of adjust your step to either step over it or whatnot. So some of this is a little bit more conscious thought, but there's still a big subconscious piece. And a lot of it, we learn that through where you're walking and you see that I have to pick something up or I have to open a door. You're anticipating that this is gonna throw me off a little bit. I'm gonna have to weight shift. I'm gonna have to do whatever I need to do so I don't lose my balance. But you see it coming, okay? So your body has a few seconds to adjust to it. And a lot of this gets better with practice because our body learns through practice, and it kind of stores that somewhere in our brain and says, okay, last time I opened this door, it took a little bit more effort than I anticipated. So you're kind of prepping for that, all right? So again, this is an area that you can improve with exercise, physical activity, practice, whatever. Because you are kind of challenging your system more, and your body's learning how to respond to that. That's a huge thing that we do in physical therapy, and I know that happens at Rock Steady as well. You're challenging yourself, because if you don't have someone kind of encouraging you, you start to avoid those things. All right, I know that this is gonna make me lose my balance, so I'm not gonna do that. But that's not what we want you to do all the time. We wanna make sure you're challenging yourself in a safe manner, and having the help of personal trainers or physical therapists, or even just family, to make sure you're still safe while you challenge yourself is a really good thing to do. So we already addressed that. What do you think you can train? We can't really train our reactive system too much. All right, we can do a little bit down here, make sure we have flexibility, make sure we have the strength, but we're not really changing that automatic system and how quickly your nervous system is working as directly as we can this one, the anticipatory. All right, we really can impact that anticipatory system. So we practice those things that are challenging for you. If you have trouble stepping onto the curb to go to your doctor's, or those 2 steps to get into your daughter's house, or whatever it may be, the more you practice it, the better you're gonna get at it, because you're anticipating what the challenge is. Okay, when I go up these steps, I tend to fall backwards. I need to correct my balance, and I need to lean forward a little bit more. Okay, so the more you practice those things, the better it's gonna get. Your brain learns through practice. All right, falls prevention. We kind of talked about a lot of this stuff already, but I just kind of want to kind of point these out specifically. All right, so minimize environmental barriers. All right, keep spaces wide. Make sure your house, everything in there is nice and stable. Level floors. If you need a handrail into the house, make sure you get somebody to install that who knows what they're doing. Be mindful of your triggers. Everybody has different triggers, okay? Things that make them lose their balance or they're walking worse. A lot of times you might have to ask family or friends, when do you notice that I kind of seem unsteady? Because sometimes you don't have as much perception of that. Sometimes you do. It just kind of depends on the person. Some people are super mindful of that and some aren't, okay? This is something we kind of pick out in therapy as well. Reduce dual tasking, we talked about that. So avoiding conversation if that's one of your triggers. Avoiding, pulling your phone out, making a phone call. Even sometimes for some people, it's just carrying something that would be enough. So kind of knowing your limitations there, and then, minimizing that. Again, not that I don't want you to do it at all, because if it's not a problem for you, I want you to do it. It's gonna keep you kind of up on your game there, but if it is a problem, don't do it until you practice it enough that you know you can do it safely on your own. Strength, power, balance, exercise, okay? Exercise is kind of just as important as taking your Parkinson's medicine every day, because it is going to train your system to do these things, okay? You have to have the strength to recover a loss of balance. You have to have power, which is kind of a speed-based strength, okay? So strength is just the ability to do something with load at a kind of a moderate speed. But to do something quickly, whether that's a bicep curl or a sit to stand or a big step, it has to be quickly for it to be efficient. So that power is a big piece that a lot of people don't train when they get older. Even people without Parkinson's, that's one thing that they don't do a lot, is work on power. And then balance exercises are going to help as well. As we talked about, physical therapy, rock steady, Tai Chi is another good option. Dance classes work on that kind of reciprocal movements and kind of that weight shifting, large steps. So anything that kind of fits your interest can be good for you, okay? So here's some ideas, some general stuff that you can do to help you work on your balance, all right? You can work on your wide turns. Again, you have to practice this stuff. It's not natural, and it's definitely not natural once you have Parkinson's, but working on wide turns. So it's a larger turn, it's a U-turn, but it's also a wider base of support, okay? I also like to work on figure eights. I can set up a couple cones and I have people kind of walking in a figure eight, and I'm working on that wide stance and the big steps. Okay, sometimes one cone is enough and you work on walking around one cone. Sometimes you need a couple cones and then like a semicircle to kind of give you a visual target of what to walk around. Okay, so figure eights and wide turns. Sit to stands is an exercise that I give to almost any patient unless they have really bad knee arthritis. Everybody's doing this, okay? Sit to stand is one of the most functional ways to strengthen your body and to help reduce falls and help keep you mobile. I have people do them just nice and kind of a normal speed, and then I'll work on people doing it quickly. All right, so that quickly is working on that power, okay? You can also do it holding a weight or with the resistance band around your waist if you want to further challenge yourself, and you can do so safely. Multi-directional stepping or walking. This can be a variety of different things. This is like you could go on and on about different ways to do this. It can purely be lateral steps. It can purely be backwards walking, just because we don't do that a ton on our own. It happens throughout the day, but we don't practice that. And we definitely avoid it as we get older. So side steps, backwards walking, and then just the stepping. So some people have heard about like the Big and Loud program that people do with Parkinson's. All you're doing is multi-directional stepping. It's not like rocket science. You're working on big steps each direction, okay? So we are basically we're practicing that steppage strategy that I talked about earlier, okay? You're working on different large amplitude movements, and then as you get better, you can add in some dual tasking, some counting, or upper body movements, and then you can also start switching legs to make it more challenging. You can also do it on various surfaces, so you could step onto like a kind of couch cushion or a yoga mat or something to make it more challenging, again, depending on where you're at with your disease. Multi-directional stepping, multi-directional walking, super important. This is something that we do in therapy a lot, and I know that is done a lot in Rock Steady. So, postural exercises. So with Parkinson's, a lot of people end up kind of here. Not everybody again, but with this, your tendency to kind of use your hip and trunk strategy declines, and it also causes you to be a little bit more unsteady because you're not centered over your base of support. So working on things to promote an upright posture, trunk extension, that can be like using bands and doing rows. That can be just doing some backward bending over your chair. A lot of yoga encourages that trunk extension. And then also some rotational stuff in there is helpful too, all right? Ankle flexibility, this is an easy one. And anybody over 65 should be considering this, because if your ankles are tight and they don't have a lot of good flexibility, you're not getting adequate foot clearance as you step. So you could just do a simple calf stretch, your hands up on the wall or on the counter, your heels on the ground, and you're leaning forward until you feel a stretch in your calf muscle. All right, so that can be done for anybody. We kind of recommend that or assess that for most of our patients as they age, because those muscles get tight and it doesn't allow you to kind of clear your foot as much when you walk. So those are some options. All right, falls recovery. So basically protect your head and face. That's the most important thing to do when you fall. If you can. I mean, some people don't even have the reaction to get those hands up, but if you can, you want to protect your head and face. You want to avoid falling on a outstretched arm. All right, that's a high risk for fractures in the wrist, elbow, shoulder. So you can try to catch your balance on a table or a wall, but if you're going to the ground, don't try to stop it with your arm, because as you age, bone health is not as good and you'll be at risk for fractures. So as you go to fall, if you're not able to kind of recover early, you're kind of tucking that arm in, and you would rather land on the back of your arm or your shoulder blade than your arm like this. Practice floor transfers. This is like super important, something you need to do before you even feel like that you're gonna fall or you've ever had a fall. If you fall, most people it's very traumatic because they don't know how to get up, they're flustered, they don't know what to do. But if you know, like, all right, I fell and I'm safe, but I know how to get up, it kind of calms that nerve and calms that anxiety that happens with falling. So practice getting on and off the floor. If you need to do it from the edge of your couch to get on and off the floor, that's a start. Using a chair, that's a start. And then eventually, if you're mobile enough, you can do it without. And then it just kind of eases that anxiety about a fall, because a lot of people are afraid they can't get up. Okay, so if you practice it, you kind of figure out a technique that works for you. Have a plan, make sure you have a phone on you, a life alert. A lot of the new Apple Watches and Android watches have options for that. But just make sure that you kind of know, if I fall, what's my plan? All right, can I get up on my own? What if I get hurt? Do I have access to call somebody if I'm home alone? So have a plan. And then kind of some big things to be mindful of. If you hit your head, especially if you're on a blood thinner, you want to make sure that you are either going to the ER or you have somebody there monitoring you as well. So if you hit your head, you have a chance for a brain bleed of some sort if you hit it hard enough, again, especially if you're on blood thinners. And a lot of times that doesn't show up immediately. You may be fine, and a couple hours go by, and you might feel groggy, or you might have a headache, and those are signs that are often delayed, because a lot of times you can get a specific type of brain bleed. It could be a slow one. So just be mindful, like if you want to make sure that you're pretty much back to baseline before you're going to sleep, especially if you hit your head pretty hard. Anytime you're unsure, go to the ER and get it checked out. Wrist, elbow, or shoulder pain, as I mentioned, high risk for fractures, and unable to take more than 4 steps without a lot of pain. So if you can't take more than 4 steps, that is an indication that you have a possible fracture. So those are some many things you definitely don't want to miss. All right, I don't know, I found this picture, and I thought it was funny. Apparently there's these new things that are like airbags for your body. I don't know, and this I think was kind of a meme making fun of those. But anyways, be prepared. People with Parkinson's fall, it's very common, okay? So hopefully it's not as much, and hopefully you're doing everything you can to minimize that. But be prepared, have a plan, practice those floor transfers, and be proactive in regards to exercise, participation with a physical therapist. I suggest that a minimum once a year, depending on where you're at least to get evaluated, and to develop a good home program for you so that you can work on those areas. But just be prepared, because this is very, very common with people with Parkinson's, and it may not be happening now, but in 5 years, 10 years, you're going to see it. So make sure you're being proactive in that regards. I thought that was a funny picture. Okay, I wasn't super short, but questions, concerns? Yeah.
Can you tell us more about the airbags?
So I don't know much about them at all. I've seen some like commercials on them, but I haven't looked into them too much. And when I was looking at all this last night, it did pop up on my. I was kind of looking to add some pictures to my presentation, so I don't know that much about them. But there's some that are like vests or coats, and there's some that actually has a hood.
Yeah.
And, but I don't know how it's, like, I don't know if it's a sensor thing or if you have to pull it, I don't know.
No, it is a sensor.
It is?
I've looked
Okay.
into these quite often. It's a Japanese company that made these, and I've been following them, and I need to actually go back and look at it because I was wanting to contact them to just see if they would just even send some. I'm sure they're expensive, but also just to see whenever they would come available in the U.S. But it's literally a motion censored, so it's a vest, and they even have some that that the airbag will come down over
To
your
protect
butt,
your
but then also
conscious.
it will come up over your head, so a hood on your head and even over your arms. And so if you fall, it's literally a full airbag that
Oh
breaks
my
your
gosh,
breaks your
this
fall
is
and then
never
slowly
seen it.
deflates.
For jockey.
For jockeys?
Yeah, yeah,
That's what they were originally designed for.
yeah. Jockeys, and then they realized that like, okay, we can probably use this for all kinds of other things. So if you just go on like YouTube or something or online and Google it, you'll see a lot of them. It'll be either the doctors or just people just trying it out, and they're literally just falling backwards, and then it pops up.
open.
I mean, way before they're even to the ground. It's like even if you're just off, to the point where that you're going down, but just at that angle, it go ahead and inflates. It's amazing.
That is
Yeah.
really, really neat.
Yeah.
So,
But yeah, I'm gonna do some more research on that to see.
with a car airbag, it doesn't go back in.
No,
Right.
and so I'm
So
not
are
sure how that
these
one
a
works because it is like a
one-use-
car airbag.
Okay, so were these a one use?
I'm not-
As in a
yeah, I'm
one
not sure
fall
about that.
thing?
Yeah, I would think that if they're gonna make it like that, it would be, where it deflates and you can multiple use it. So yeah,
That was, yeah.
yeah, yeah. Thank you for bringing that up.
Thank you so much for mentioning
Yeah.
that
You
and
said
then
something about
filling in on
Yeah.
blood
the,
pressure.
me
Blood
put that
pressure,
stuff.
there's always, a lot of times comment that, it's not high, but, it's at not overly low, but
Yeah.
it's lower than a lot of people.
Yeah.
So
Do
is
you know-
that something with Parkinson's?
It is, do you know what it is? Just to kind of get an idea, you don't know?
I don't remember,
Okay, that's
but-
fine. So the thing is, like, when you assess blood pressure in a sitting position, that's just one position, and that's where it's, most of the time, when you're at the doctor's or whatever, you're getting blood pressure assessed sitting. But that's not when people have a lot of issues, it's when you stand up and it drops, so that's where it becomes more of an issue. So if his is running a little low, I would be interested what it was in a standing position. So if you have a blood pressure cuff at home, you may check it in a sitting position and then in the standing position. 10-degree change or 10 millimeter mercury degree change is normal. It's still enough to make you just a little lightheaded, but if it's more than a 10 point change, that is abnormal, okay?
So it's something like when you see his neurologist, maybe have them check it sitting and have him stand up or
Yeah,
something?
you don't have a cuff at home?
No.
You can probably get one, a lot of health insurances will send you one for free if you just call your insurance company, or if you have a flexible spending account, they will cover them. It's worth having one at home. Because if he's having an episode where he's real lightheaded or a little off that day, you check his blood pressure, it's low, then that it's up. It's
Well,
nice
most
to have
of the
one.
time it's maybe 110/60
Yeah,
or something like
that isn't normal blood pressure for
Yeah.
a healthy young person, but for the older population, if he stands up, then we're at 100 over 50, which then now we're talking about that's low. So to sit in a position, you might be fine, but if it's dropping when you're standing, it could be an issue. And it sounds like at this point, you just need to monitor it.
Well, we haven't, I don't know if he's had any trouble
Yeah.
in
No?
that,
Okay.
but it just was curious, cause
Yeah.
I hadn't heard about that, and I thought, well, I better ask.
Yeah, that's fine. I
it
would
was
say,
our cardiologist that first, tipped us off on that and said, your husband's got Parkinson's, we need to do these sitting and standing in line. Yeah, so it was the
And-
cardiologist.
and I think it also depends on kind of what your baseline is. So somebody that, if you've been super active your whole life and you've been very healthy, it's normal to have a low blood pressure. But some people have a kind of a higher blood pressure, and then as their Parkinson's comes on, it drops. Their body's not used to that, so it might be more symptomatic. But somebody that's been really active, a walker, runner, biker, low blood pressure is normal for them because they've lived a healthy lifestyle, so he may not be as sensitive to 110. That may be normal for him. It may have always been low, because depending on health, your health.
Okay, and then the other thing that I thought was interesting, you were talking about like doorways and stuff.
Uh-huh.
And it made me think, like, our bedroom, we have a bedroom, and then the bathroom is right to the right, and in front of it, there's a closet door, you know, like
Okay.
outside in the hallway, so it's like, you know, when he has had trouble is at night going to the bathroom, sometimes he's run into the wall or something like that. You were saying about trying to do a bigger turn or something. I
Yeah,
don't know.
so it sounds like if that's a tight space, he has to work on what I call it. We call them like box turns, or I like to call them a penguin turn, but, so if you're in a tight spot, you can't make a U-turn, right? So like, you can't make a big U-turn if all you have is 2x3 space, you know? So what I work on is what either 90-degree turns or what the box turns are, so you're working, and he may go in that space, and he can face one door, and this is something that anybody can do. You start by facing one door, and I'm gonna take a 90-degree turn to the next door, and I wanna be able to do that in 2 steps, one step each foot. That's your goal, okay? So I work on these 90-degree turns from one wall to another, if it's kind of like a square, and we work on that.
So
And
that
some,
would be something.
yeah, that'd be good.
to
And some people like to kind of march with that kind of helps them. Kind of, the more you kind of work at that higher amplitude, when you do it unconsciously, you've trained your body to go to work higher that it does it without thinking about it. So you can work on 90-degree turns, and then if that gets easy, he can work on doing like a 180, and then back, again, kind of work. Now, right now, it might be 2 steps to get there. But work on getting 1 step with each foot.
But, so that if we do that during the day, it might help
Yeah.
like at night when he's
Yep.
not as alert.
Yep, and then obviously having a little nightlight in the bathroom
Well, we
needs to give them
have
a
all
visual.
that.
Yeah.
And then the other thing, do you have a, change of visual pattern between whatever the flooring is in the bedroom and whatever the flooring is in the bathroom?
Mhm.
Like, is your bathroom tile and the,
Well, we have,
Is it
like
all
in our bedroom, we have like a flat carpeting, and then in the hallway, it's, kinda like this
Uh-huh.
table like,
yeah,
and then the bathroom is a tile.
so they're all
So
different.
more
which-
visual
that
processing
helps.
going on.
Yeah, that sometimes can help though, when it all looks the same, it kind of depends on the person. So, he could use that visual piece as like something to step 2, like I gotta get to the tile, or I gotta get to the laminate. So that visual piece can help, but yeah, so sometimes it is just, a little bit more processing, yeah.
It just, you bringing that up is like, oh.
Yeah.
maybe-
Yeah, a good place to just stand and practice that during the day. We like to kind of find those things that are triggers, and in therapy, I try to mimic them as best I can here. But yeah, practicing that at home during the day to be more efficient with it.
Thank you.
And I might just add that, we've had a blood pressure cuff, a digital one for a long time, and they're really easy to use. And they record, you have a recording of all the blood pressures that you've taken.
Mm.
You can even have multiple people set up on it. I mean, it's not really a setup, you just switch from 1, 2, 3, or 4. And, you can actually take, 2 or 3 people, 4 people's different blood pressures and have it recorded under that number. And they're
Just
not
jot
that
it
expensive.
Yeah.
And,
Yeah, you can get it for like $20-$30.
And that really helps with doctor appointments sometimes too.
I
Because
know,
you have a
like we
record
were
there.
taking it like at the YMCA when we go a lot, but I didn't, when you were saying.
Yeah, I think
about-
different times throughout the day plays a big difference, and then different positions too. So it is nice to kind of take them throughout the day, because they might be okay in the morning, but by the evening it's dropping down, or vice versa, so.
And consistency apparently is part of it, because when the cardiologist got us set up with this, in preparation for the DBS, was take it every morning before coffee, because the caffeine in the coffee would elevate the blood pressure, so take it consistently, even if you're taking it at multiple times.
But like I said, I hadn't heard about the blood pressure.
Well, we were just lucky to have that cardiologist there for a while.
I had one doctor's office say, when you're older or elderly, that it's good to have a higher blood pressure. I had another doctor say, no, the 120 over 80 is what they want.
Yeah.
So,
Yeah.
how do do you feel like if you're older, is it better?
I think it depends on the person, yeah, kinda depends on the person. I think the reason they say it's better to have a higher one is because the small blood vessels in your brain are kinda weakened with age, and so sometimes I don't know if you've ever heard of like small vessel disease. It basically means like the very end of your blood vessels, the very outside portion of your brain, they start to collapse on themselves a little bit, and so you end up with just small, like very small brain damage over time. And that kind of shows up, you'll see it with people, that are older, sometimes they call it, like I said, they call it small vessel disease, so they do an MRI, and it's all the areas that are impacted are where the last part of that blood vessel is, and it's just not getting sufficient blood flow there, so a lot of times the reason people like it a little bit higher is because it pushes into those blood vessels and it keeps them open, even though the blood vessel itself might not be as kind of flexible as it used to be. So I would assume that's probably one of them, and probably another reason is because with multiple medications, blood pressure being low can be an issue, so maybe they just say better to caution on the higher side. But if somebody has a history of a stroke, no, not necessarily, you know, it just depends on the person, that's probably why is my assumption, so.
I'm assuming maybe exercise would be good for the small vessel issues with age.
Absolutely, exercise is kind of one of the best things for the brain and neurological health, and that's one thing we've got another talk on exercise, kind of last summer, I believe, so it's probably on their YouTube, but we talked a lot about exercise being basically just as important as medicine. It's gonna help you, obviously, with just your muscles and joints and your power, but your neurological system, there's been a lot of research that shows that exercise, especially if you can work at a moderate or high intensity safely, actually produces a lot of neurochemicals in your brain that is protective. Okay, so anybody that gets recently diagnosed with any neurological condition, whether it's MS or Parkinson's or whatnot, we wanna get them an exercise program that's safe, that you can work at a moderate intensity, because you're producing a lot of neurochemicals that protects your nervous system. So yeah, that's always a good thing for that neurological health, and exercise is super important for that.
They were saying it was the only disease modifying
Yeah.
treatment
Yeah.
for Parkinson's. I don't know if that's still the case, but I suspect it is.
Yes, probably.
Any other questions? Well, thank you.